Okay, dear friends and colleagues, even if I don't see you, I feel that few of you are there. And if I could see you, I would ask you to raise a hand who can confidently point Latvia on the map, but it's not an option currently. So I will try to share the screen. I hope you do see the screen at the moment. So my name is Valts, and I'm acting as the CEO of the Children's University Hospital in Riga, Latvia. And together with my colleague, Vita, we are delighted to share with you the story of our journey towards a better patient and family experience in our hospital. So in 10 minutes or so, I will introduce you to some like general basic info about the hospital, and this will provide you the context to the more specific topic of patient experience, which will be presented by Victor later. But for those of you who struggle to locate the name of Riga and Latvia on the map, I will start with a quick memory refresh. And so this is a map, this is Riga, and we are pretty well connected to all of the Europe, and it's really a short flight. And for those of you who want to learn a little bit more and see the presentation about Latvia, you can use a QR code to download and see the beauty. But to continue, as you see on the map, we are one of the Baltic states and neighboring with Estonia and Lithuania, but also the Scandinavian countries. On our east, we serve as a border for European Union, and we are bordering with Russia and Belarus, and that's why we are always alert. Those of you, as I said, those of you who want to learn more, you can also go to the website regarding the Latvia. But just a few quick facts which will help you to also serve as a context for what we will discuss regarding the hospital. So the capital is Riga. We are in the European Union since 2004. We are less than 2 million population. We have a pretty big territory, and meaning quite low population density compared to many countries in Europe. So those of you who like the nature, that's a place to visit at some point. We have 500,000 of coastline, sandy beach, with not too warm sea temperature, but anyway, it's still beautiful a few times a year. And we really have a very nice capital, a lot of lakes and other beauties. But coming back to our capital, it's quite a historic capital, so with a long history, and at the same time, it's pretty modern. We have one of the best Wi-Fi connections, I believe, in Europe, or even outside Europe. But other thing which is kind of linking to my story is that almost half of the country's population lives in Riga. And that explains very much the, I would say, quite centralized healthcare delivery model. And specifically considering the hospital care and the children care. But it also means that hospitals located in Riga serve not just the whole country, but not just a city, but the whole country. So meaning that we are not responsible for the nearest neighborhoods, but basically responsible for all of the children's health in Latvia. And even though we do have some pediatric wards in regional hospitals and also some perinatal centers outside capital, there is just only one children's hospital, and it, in a way, have a task to cover all the fields. So our hospital was founded more than 120 years ago. And we are obviously proud of its heritage and a long history. The that heritage and that history is reflected in the traditions, the culture, and the pride of the hospital. Nevertheless, it also comes with some cost, and that cost is also associated with this history. And it considers some limitations related to the infrastructure and all of the campus, because we have to mix the old and the new. And the old not always deliver up to the current expectations of the people. So our hospital is not only for the treatment, as we are a university hospital, but it's also the place for education, for students and also for residents, and also the place for knowledge and know-how nest basically on any topic related to children's health. So unsurprisingly, being the only children's hospital, we need to cover many therapeutical profiles in a different levels of care, including emergency, inpatient, outpatient, daycare, also rehabilitation services. So all of the spectrum. So we have around 2,000 colleagues working with us in a hospital to serve the patients and families. And we also act as a national specialized center in specific fields. For example, like National Rare Disease Coordination Center, Sports Medicine Center for children and adolescents. So we serve as a vaccination center for children, and also the Epilepsy and Sleep Medicine Center, and so on and so forth. So just to give you some perspective in order to probably to compare our activity level, I want to provide some of those figures from 2020. I have to mention though that similar, I guess, to many other children's hospitals in 2020, we saw a quite significant drop in our activity level. And that was mainly due to restrictions to provide elective care, especially non-acute care, as well as the significant decline in infection rates. And also, I have to say, for some period of the year, the children's trauma was less than usual. So I would say these figures are somewhere between 25 to 40% lower than we would normally expect and see. So, and that includes everything: emergency service, outpatient service, inpatient service. So all of those figures are a bit lower, or even significantly lower than we saw in 2019, for example. But at least it gives you some perspective of what size hospital we are. Dynamics in these figures over the year would indicate also the way how we work, as our key priority is really to reduce the necessity of the child to stay in a hospital, and we're trying to integrate as much service as possible outside the hospital stays. So obviously we are here for the patients, and if we have not succeeded to keep the child out of the hospital, our obligation is to do everything to improve his quality of life and also experience during the hospital stay. And we're also trying to shorten that stay as much as possible, allowing really continuation of the care or reconvalescence in his usual environment, which is most often at home. So this kind of slide represents our efforts, shortening the stay, but also improving the quality of life and experience. So this is a strategy map of our hospital. And there are several building blocks, and these help us to fulfill our mission. And our mission is not just to treat and care, but also to teach and inspire children to attain more fulfilling lives. And clearly, achievement of superior patient experience is absolutely essential element of our hospital strategy, and one of those top 5 strategic goals. And you can see on a strategy map, and there are some more detailed explanation of those 5 building blocks, and positive patient and family experience is among them. And the patient experience is also, as you know, the cornerstone of the quadruple aim, which is defined by Institute of Healthcare Improvement. And it helps in a way to achieve other 3 goals. But it is extremely important, not just basically to remember that we are not just for treating, but we also have to remember how the patient and family feels throughout all of the process. And therefore, patient experience measurement, which is like a routine procedure currently at our hospital, helps us to learn about the patient and family perspectives on complete process. And it reveals elements which we as a provider might miss in the scope, but which are very, very important for the patient. And I regard the patient experience measurement really as a management tool. And it's obviously just the first step to measure the results, and much more important is what we are going to do about them. And, we as a hospital leaders are really driving that never-ending spiral of improvement, and that's our daily job. Another unique value of the patient experience measurement solution is access to data in real time. And that adds a lot of value, and Dieter will share our ways of working, how we do that. And you can see almost instantly and start to evaluate any improvement initiatives, shape them to achieve the best possible results, or to amend them if something is not delivering. I will not be able to name all of the improvement initiatives and development projects we have today in the hospital, but we are in a phase of massive transformation to adjust our infrastructure towards better serving the purpose, our common purpose, to ensure the healing environment for the patient and families, but also environment which facilitates the staff engagement and supports the optimal ways of working. And well, naming just a few of initiatives, we're talking about new rehabilitation environments, so new mental health center, new emergency department, considering all of the challenges which we learned during the COVID crisis. We're talking about new sleep and epilepsy medicine center, and more and more. So most importantly is, I want to mention that all of these activities, you can see the campus side, and it fortunately or unfortunately will become a massive reconstruction site and a building site. So we will need to somehow to live through it and still deliver the patient and staff experience. But most important is that all of these activities are done with engagement of patients and the field staff. And I'm talking about obviously the patient council, patient organizations, etc., etc. One thing which I just want to mention, that to kick off the project of the project planning for emergency department, we went through the rigorous design thinking exercise with really extended team, and that was very, very valuable to identify different personas and think of their preferences or the needs. Okay, and finally. As I mentioned before, we are very privileged that we are only pediatric hospital in the country. And it means that not only technologies are concentrated, but almost all of the know-how in children's health stems from our hospital. And therefore, this privilege comes also with kind of moral responsibility about really every aspect of the children's health in Latvia. Not just activities performed directly inside the hospital. Latvia is small, and therefore we believe that children care can be effectively connected. And the children's health ecosystem is really the strategic initiative of our hospital towards the digitally enabled integrated, patient-centered solution to improve the children's health and well-being. And well, things like information channels, patient portal, care pathways, telemedicine solutions, probably digital diagnostics, digital therapy, clinical decision support tools are just few examples of what's in the scope of the future development, and we have started to work on that. So digital health solutions help to connect virtually every aspect of the health. So and I would say that would become an ever expanding ecosystem, and that will support more informed health decisions and improve the patient experience. And there are a few essential building blocks. I just very briefly name them. So one is a virtual health club, health hub, or health academy, and that's a source of reliable information in any aspect of the children's health or self-care, not just disease, but also the health development. And we know that there are plenty of information regarding the health, but very few credible sources. Now, our aim is really to be like this concentration of that reliable information on children's health for the Latvian patients, families, but also other caregivers and teachers, etc. Then the patient portal, where access by secure authentication will allow the access to individualized care plans, and potentially that could be expanded also to incorporate useful apps, etc. So basically partnership with many partner organizations. So Professional Portal is a platform allowing safe and efficient patient physician or physician interaction, potentially distant monitoring. We are in some pilots and also diagnostic support. So our hospital serves as a children's health competence and continuous education center, which kind of is responsible for knowledge transfer, and that combines enhancement of theoretical knowledge, but also the practical skills, including all kinds of simulations. And we are developing the hybrid models of how that education could be delivered. And then we have launched recently one activity to develop the community or family interaction space. We know that there are patient organizations and they are scattered around the field, but such environment in which the chronic patients, rare disease patients and others can form their own communities and stay linked to the hospital and being able to escalate the common either medical or social problems would be very valuable support for the patients and their families. And finally, the digital data lake is, it's well known that digital health is a link between the data science and the healthcare. And we are the only hospital in Latvia with a full electronic medical record. And our aim is really to build that digital research environment where we will harness if I may say so, this powerful combination of rich healthcare data with data science and digital innovation, and that will boost the future healthcare advancements. So obviously, we are not doing that alone. We are trying to partner all over with the industry, with the top tech companies, academy, governmental, non-governmental organizations, patients and families. And there's plenty work ahead, but outlook is very busy, but I believe it's also bright, and I believe it will really help the patient experience to go up and up. And I hand over now to Vita, and she will share the initiatives we have already in place and the measurement we are able to do, and tell about the strategy of improvement. Thank you.